Oh, sure. Thanks. Thanks for having me here. It's always so hard to follow Burning Man. So much joy and pro-sociality, and I'm just going to bum you guys out with addiction and heartbreak, misery. It's a cheerful enough team, though. A lot of happy people. All of us are at USC, except for John Doris, who's at Washington University in St. Louis. John Doris is a moral philosopher. I'm a moral psychologist. John Monterosso is a neuroscientist who studies addiction, so he's kind of our resident expert on addiction and addiction recovery. Morteza Degani is a psychologist and computer scientist who specializes in natural language processing and big data approaches, and so he does a lot of our text analysis. Carol is here today. She'll be presenting a poster tomorrow. She and Lucas and Peter, grad students at USC, all interested generally in political ideology, morality, habits, and self-control. The main goal of our project was to try to develop an empirical method for studying the causes and consequences of transformative experiences, specifically by combining natural language processing, which is basically fancy text analysis, with addiction recovery narratives. And the reason we were interested in addiction recovery narratives is a few reasons. One is that they're very phenomenologically rich. So we started reading a lot of these narratives. John Monterosso had been doing interviews with a lot of addicts and former addicts. And people, they're sort of like what Dan McAdams would call deep narratives. They have a beginning, middle, and end. People talk a lot about their thoughts and feelings, changes, emotions. And for some of these cases, some of these addiction recovery blogs, people have generated hundreds of thousands of words over a period of several years or even decades. So there's a lot there. They're very plentiful. People are very willing to share these narratives. They share them online. There's a lot of text that we could get for them. And so there's a lot of addiction forums on Reddit. There's a lot of Facebook pages, Facebook groups devoted to addiction recovery. And in a lot of the cases, there's clear measurable outcomes, right? So a lot of times you can actually specify, did this person's recovery experience lead to continued recovery or lead to a relapse? So those are why we're interested specifically in the addiction narratives. In the study that I'll talk about today, we had three specific questions. First, we just want to know, can addiction recovery be a transformative experience? Right? Because at first you might think, well, does that really count as transformative in the sort of Lori Paul way? Is that specific Lori Paul way? Is it sort of going back to a state you were before? But a lot of people were, I guess, children when they first started using substances. So we weren't too sure about that. We were interested, I'll just say a little bit about how aspects of transformative experience might actually relate to different recovery outcomes in a population of addicts and former addicts. And then the thing we were most interested in is, can we find indications of transformative experience in recovery narrative language? Just look at the words that people use to talk about their experience. So this is an anonymous survey we did. We spent some time actually trying to reach addicts and former addicts. And so we posted links to an anonymous survey on a lot of different addiction forums. Again, these are places where people come to sort of share their stories. So people were very motivated to share their stories. We just said we're interested in hearing about your experience. And we actually collected a lot of data via Qualtrics panels, which is really nice. They can find very, very specific populations. If you're looking for a very specific group, so in our case, we were looking for people who have gone through addiction recovery, Qualtrics panels is a pretty nice way to go. The substances that people mentioned that they had felt that they were addicted to, most of them mentioned alcohol. People also mentioned marijuana, cocaine, heroin, opiates, that includes pain pills, meth, speed, amphetamines, 6% other. A couple people mentioned cigarettes, a couple people mentioned hallucinogens, but this is the majority, and the majority of these people who filled out this survey specified several different substances. So a lot of people talked about having some sort of addiction to some kind of substance leading to other substance addictions. So we had a couple of filter questions where we just wanted to make sure that they felt that they had been addicted to a substance and that they had a period where they tried to either quit or drastically reduce their use of that substance. And so if they answered yes to both those questions, then they were taken to the first actual question of the survey. This is our most important question. We just wanted them to generate text. We wanted them to talk about their experience. So we said, please walk us through your experience reducing or quitting your use of whatever substances they had checked, all the way up until today, what your thinking and experiences were, what challenges you face and still face, people or things that might have helped you to reduce your use, Please include as many details about your experiences and thoughts as you can. And again, people were quite willing to sort of open up and talk about their experiences. We had a wide range of kinds of stories, some of them really sort of gut-wrenching, some of them really funny, some of them actually kind of positive. So our first question, can addiction recovery be a transformative experience? After we had them generate this kind of open-ended text, we asked them some questions that were designed to try to get at that special Lori Hall transformative experience. So Lori already talked quite a bit about this, so I won't go into detail. So the first sort of aspect of TE we were trying to get at was the epistemic. So for this, we asked people, before reducing or quitting your substance use, how well could you have anticipated what life would be like after reducing or quitting your substance use? And here we actually saw that almost half of them said, I had no idea what life would be like after. And then some people said, I slightly knew, I somewhat knew what life would be like after, or I very much knew, or I completely knew. So quite a few people were saying that they had no idea. Here's an example of somebody that said they had no idea. I didn't know any way of being happy other than using drugs. And I think that is a big deal because I didn't know what was on the other side of the fence before compared to now. I do know what is there, and there's a bright light, a great life, and endless happiness through sobriety. So this is one person that said, I had no idea what life would be like after. The second question, I have a longer passage from Lori here because she gives a lot of examples of different kinds of events that might lead to personal change. And what I've bolded here are cases that our participants actually brought up. So these are the kinds of events they actually talked about. So having a traumatic accident, experiencing the death of your parent, or experiencing the death of your child. So we had a lot of stories about, I was drinking and driving and my kid was in the car and we got into an accident and my kid died and that's why I stopped drinking. Or, my parent died from a drug overdose and that's what got me to stop doing that same drug. So again, a lot of sort of painful stories, but these are things that people brought up. So we asked people, to what extent did changing your substance use change who you are as a person? And here too we see that the majority of people are saying it completely changed me as a person, or it very much changed me as a person, and then a few people say somewhat, slightly, or not at all. But again, the majority of people in this survey said it either completely or very much changed them. So another example, I feel myself like a totally different person. I could focus on my job easily, a lot calmer, way more relaxed. Nowadays, the temptation of having a shot or a glass never came to me on weekdays. I don't run to alcohol every time I face a problem. So that's something that says that they completely changed as a person. And so, Lori says there are these two different ways of being transformative and sort of bearing this out. When we just look at how these two variables correlate with each other, they're modestly correlated at about 0.32. So they are related. So the more likely you are to describe having this kind of epistemic gap, the more likely you are to say that you changed as a person, but they're certainly not redundant with each other. And they're not the kind of thing that you would treat as a single factor. So we really do see these as two separate predictors. And Lori says the kind of case that's especially interesting to her involves an experience that is both epistemically and personally transformative. Now for some of our analyses, we want to sort of create a binary between transformative experiencers and non-transformers. And so in that case, we took people who said that they had no idea what life would be like afterwards, and that they had completely or very much changed as a person, as people who sort of met this criteria of having both the personal and the epistemic TE. And so when we split the sample that way, we have 235 transformers and 330 non-transformers. That's just for the analyses where we need to create two different groups if we're doing like classification analyses. But for most of the analyses, we're just treating these personal change variables and epistemic gap variables as continuous predictors. Okay, so I think addiction recovery can be a transformative experience. So now, do aspects of TE relate to recovery outcomes? One of our first filters that we ask people, just to make sure that they sort of qualify for the study, is to describe what kind of recovery experience that they had attempted. And so in cases where they said, I drastically reduced my use of the substance, I'm still using it some, but not as much as I was before, we consider that recovery. So even though they're still using some of the substance, they drastically reduced it, and they stuck with that reduction. In cases where they said, I drastically reduced it, but now I'm back up to using it at the previous level, we consider that relapse. Similarly, if people said, I attempted to quit, and now I don't use the substance at all, we consider that recovery. If they said, I attempted to quit, and I quit for a while, but now I'm back to using the substance, we consider that relapse. So we can sort of categorize people as relapse or recovery. In this sample, 25% of the people in the sample had relapsed, so they were back to using it at the original amounts, or they had tried to quit, and now they're using, and 75% of them were in continued recovery. So it's just a basic question we had was, well, are there any differences in these kind of continuous variables of personal change and epistemic gap between people who have relapsed and people who are in recovery? And we did find a difference for both personal change and epistemic gap. So in both cases, people who had continued recovery were more likely to describe this sort of transformative experience, that there was an epistemic gap, that there was a personal change, but significant difference for both of these, but a much bigger difference in the case of personal change. And this, of course, is just a cross-sectional snapshot, just a relationship between two variables at one point in time, but we'd really like to follow this up because this actually could have a lot of practical implications for trying to actually predict things like relapse and recovery. So it can at least relate to recovery outcomes at a single time point. And then the question we were most interested in, can we find indications of transformative experience in recovery narrative language? Just in the words people use, can we predict aspects of transformative experience? And here I'll put in a plug for my colleague Martez's software that he developed. It's this great program called Tacit. It's free, it's open source, so anybody can use it. And they made it very user-friendly, so you can do a lot of sophisticated text analyses, even if you're not a programmer yourself. A lot of our sort of shared grad students wrote all the help files for this program, and they used me as the guinea pig, the dumb guy that doesn't understand things like programming. And so if they could explain something the way that I can understand, they sort of considered that their help file worked really well, so this is a very usable system. One of the first methods we wanted to look at in a very basic way is we thought, okay, so can we just taking the words that people generate in their text, can we differentiate our transformers from our non-transformers, right? So we've got two different groups of people, the people that have indicated that they've had this transformative experience and people that haven't, at least as much. Just using the words, can we do this? And for this, we used a method called support vector machine classification. This is basically a bottom-up approach. So it's completely atheoretical, just take the words that are in there. Can we use those words to distinguish the transformers from the non-transformers? And the way this works is basically you take a random 90% of the text data, you feed it into the machine, and the machine figures out, okay, so these people in this group seem to be using these kinds of words, people in this group seem to be using these other kinds of words, and then you test it out on the remaining 10%. And you look at how accurate they can be, right? So then you've got a 10% of your data, you've got people that are either in the transformer or the non-transformer group, so if you were at chance, you would be getting 50% accuracy, and you want to see, do we have more than 50% accuracy? And then we do that again and again and again. So we take a different random 90% of the data, train up the model, and then test it on the remaining 10%. So that will give us a distribution of accuracy rates, and so we can know if we're actually consistently doing better than chance. And in the case of these, we do consistently do better than chance, so our mean accuracy is 62.5%, so we're not able to completely accurately put somebody into one group or another, but we can do, just based on the words that they use, we can do better than chance predicting if they are in the transformative group or the non-transformative group. And in case you're interested, we can also get weights for specific words of which words are particularly predictive of somebody being in the transformative group or the non-transformative group. A lot of these words are going to be very particular to the addiction narratives, but the top transformative experience words that these people used were user, large, larger, largest, wife, accident, murder, liver, easier, and social. So you can see, a lot of these sort of like gut-wrenching cases of, accidents or murder or liver disease. Some social thing, like wife and social, this impacted my wife. We're not sure about the larger. My colleague John Monroso thought maybe, it's such a sort of a trope in 12-step programs to talk about something larger than yourself. Maybe that's part of it, but we don't know at this point. Non-TE words are all over the place. Older, begin, anger, progress, ministry, addict, basketball, Christian, couldn't. So if you ever talk about basketball, you're unlikely to have a transformative experience. I don't know what that means. Some of the narratives that I've read, people do kind of talk about aging out of addiction, right? And that's one of the, I think, the least transformative sort of experiences of addiction recovery that we read about, is people that said, I used to do a bunch of substances, and then I basically got old, my body kind of ran out, and I wasn't interested in going out every night. So some people just sort of aged out of it. It wasn't this kind of qualitative break transformative experience. So maybe that's where the sort of older, begin, progress kind of words come from. So that's one bottom-up approach. Another bottom-up approach we can take is called topic modeling. And so instead of using single words as the unit of analysis, we actually look for topics. So what are the clusters of words that people tend to talk about in these narratives? And so we run all the text through this system, and it basically generates, here's the kinds of topics, here's the words that tend to cluster together. So people that use one of these words tend to use the other words in these topics. And so this, again, is totally bottom up. We're not putting in any sort of theory. We're not putting any constraints on the model. And so some of the topics that come out make a lot of sense intuitively when you read them. Some of them take some interpretive work. And some of them, the more you think about it, the less sense it makes. And some of them just never make sense. And so in this case, it generated 10 different topics. But then what's nice about it is that for each participant, you can actually give a weight for each topic. So how much does this person tend to talk about this topic? So this can actually generate 10 new variables now for each participant, which you can treat as continuous variables and relate them to, say, the transformative experience variables. And so this is fairly exploratory, but in this case, the topics that came out to be significantly related to the transformative experience variables were these three here, topics 6, 7, and 8. Topics 6 and 7 related to personal change, and topic 8 related to both personal change and epistemic gap, and had the strongest relation to these variables. Topic 8 was really interesting to us, and so it's words like AA, step, addict, abuse, program, recovery, treatment, sober, people, sobriety, meeting, month. So it's pretty clear that this is some kind of like 12-step kind of AA type topic, right? This is about 12-step meetings in particular. And this is really interesting to us because at least in the United States, the 12-step narrative, right, the sort of narrative kind of developed by Bill Wilson when he started AA, is the dominant narrative for addiction and addiction recovery. And so there's been a lot of critiques of AA and the 12-step approach that is just, if you're going to get over it, then you have to quit cold turkey. But things like rock bottom, moment of clarity, these kind of qualitative breaks, a lot of this comes out of Bill Wilson and AA. And so we thought it was interesting. And so we're really interested in following up and seeing how much of these kind of relationships are being driven specifically by a narrative coming from 12-step programs. And so a slightly more top-down approach, we can use sort of theory-derived dictionaries, and this is where researchers who have particular interest actually create dictionaries of words that they are specifically interested in, and then we can see how those, the use of those particular words relates to things like transformative experience. And so we had the Moral Foundations Dictionary that we developed for use with Luke. You can use it with Tacit as well. And so this had categories for using different kinds of moral language, different kinds of moral concerns, concerns related to care versus harm, fairness versus cheating, loyalty versus betrayal, authority versus subversion, purity versus degradation, and then we had a general morality category for words like moral and ethics, things like that. And so again, fairly exploratory, but we wanted to see, could people's use of this different kinds of moral language predict aspects of transformative experience. And in terms of, these are regression weights, this is also controlling for various demographic covariates. In terms of predicting epistemic gap, the only one that significantly predicted was purity. So use of purity words meant you were more likely to say that you would experience this epistemic gap. You could not have known what it was like later. And it also was the only significant predictor of personal change. And so purity came out as the one predictor in both cases here. And our first thought was, we thought that's interesting, but there are some religious terms in the purity dictionary. So words like, spiritual, I think is one of them. So we thought maybe this is being totally driven by these religious words. But we also have the basic loop categories, and one of the basic loop categories is religion, so words related to religion. And if we do a multiple regression looking at trying to predict both TE personal and TE epistemic using both Moral Foundations Dictionary purity and the loop religion category, we see that purity is the one significant predictor here. So it seems like it's not just explained by religion, and again, it's not explained just by demographics. And this finding with purity was really interesting to us because we just published a paper called Purity, Homophily, and Social Networks, where we did a kind of social network analysis. This is using Twitter data, and we looked at the use of moral words in Twitter data and how could that predict your distance on the social graph. So how socially close you are in terms of Twitter followings. And here again, we found that purity, the purity was the sort of one unique predictor of social distancing. Now this is a finding that we then followed up with several behavioral experiments. We haven't done that with the transformative experience finding yet. So there's a lot more work to do there, but if it holds up, I think it's a really interesting connection because it sort of implies that your use of kind of purity rhetoric might be a way of kind of social distancing, but it's not distancing from other people, it's social distancing from the past self. And so this distancing from the past self, I think in a lot of ways is kind of the flip side of the empathy for the future self that Laura was talking about this morning. So yes, all questions yes. Yes, I said yes, I vote yes. I didn't sleep last night. All right, what's next? Next, we want to see what's driving the purity effect. So we want to look a little bit more specifically into this, try to figure out which words are driving it. If it's not the religion words, what's going on? Is this about disgust? It's about some other aspects of purity. We also want to disentangle this from trauma, death, and family events. So we actually want to go through and do more human coding of these narratives that are generated to see, is this really about, if you had a death in the family related to addiction, that is what's predicting, say, recovery, or that's what's predicting seeing it as a transformative experience. And we also want to look specifically at the influence of 12-step language. And so John Monterosso is kind of an expert in 12-step language. We also are interested in trying to use this data set to try to train human coders to code for presence of transformative experience in other texts, right? All the sort of billions of words that we can find online. We've so far had trouble actually getting reliability for people to code for presence of transformative experience, but now we have this data set where people have told us their subjective reports of epistemic and personal change. Third, we want to examine how moralization of substance use, and here we would actually measure moralization with techniques that allow us to look not just at the use of words, but at the co-occurrence of words. So things like latent semantic analysis, we can look at co-occurrence of specific kinds of moral words and substance use words, and how does that predict transformative experience? How does that predict recovery versus relapse outcomes? And then finally, a more long-term goal. Again, we have this sort of neat cross-sectional, correlation between two self-report variables. Then it seemed like transformative experience was related to recovery over relapse. This seems potentially important, and that seems like a very tiny sort of baby step on the way. But it does seem really important to actually follow people over time and see if indicators of transformative experience, either via text or other kinds of indicators, can actually prospectively predict these relapse recovery outcomes, because that would have huge sort of practical significance. So that's it for me. If you're interested, Carol again is going to be presenting. These are bed sheets that I had when I was a kid. It's like full circle. Carol's poster will be tomorrow at 4:45. So thanks very much.